The organization that we are part of, the Sashbear Foundation, was originally started by Lynn Corey and Mike Menu. Their daughter, Sasha, was diagnosed with borderline personality disorder, and she died by suicide in 2011. And right after that, they decided that something needed to be done to fill the gap around providing services and support for families who all struggle together when someone in the family struggles with a serious mental health issue, including suicidality. So the Sashbear Foundation is now recognized after these many years as a leading voice for Canadian families who are impacted by emotion dysregulation, suicidality, and related mental health challenges. So primarily what we do at the Sashbear Foundation is train and empower family members to share life-transforming DBT skills and hope. So DBT stands for Dialectical Behavior Therapy, and you're going to hear a lot more about that. We also endeavor to build a community of support among family members and provide advocacy and education. And as an organization that started by family members, it is still run by family members, and primarily most of the work is done by volunteers who have in fact made use of our services and then turned around and wanted to share with other families in order to benefit them. So that's just a little bit about us. As mentioned, I am actually employed by the Sashbear Foundation and a volunteer for them, and Julie is on the board of directors for Sashbear. So here are some of the things that we provide. The family programs are all based at this point on dialectical behavior therapy. So there's the Family Connections program, which is a group psychoed program for family members. The Expert Education Series, which is monthly webinars with experts in DBT and on specific mental health matters. And skills refreshers for anyone who has attended Family Connections or who has attended another DBT skills group for families. And then our other activities are an annual walk. We are involved in scientific conferences. We collaborate on research. We do presentations in schools and at various community settings around the concepts of suicidality, and also for DBT skills, and workplace presentations as well around mental health and suicidality. So I'm now going to turn it over to Julie, who will discuss dialectical behavior therapy.
Okay, thank you, Doreen. Well, I'll begin with what is dialectical behavior therapy. So dialectical behavior therapy was developed by Dr. Marsha Linehan, who is a psychologist in the United States on the West Coast. She's now retired, but since 1980, she's been developing this treatment that has enormous scientific validation. It's a treatment for individuals with serious suicidal and self-destructive behaviors. Well, it was developed for that population, and now it is used widely. The goal is to provide effective treatment and a life worth living. We'll show you a small clip about you'll see Marsha, and you'll hear her about how she came to develop dialectical behavior therapy.
I started working with highly suicidal people. As it turned out, the people met criteria for borderline personality disorder, but A, I had never heard of borderline personality disorder, and B, I didn't know what it was. Even if you told me the name, I wouldn't have known. So that was the beginning of the whole thing. I had no idea what I was doing, except that I was studying suicide. What happened was standard behavior therapy of the 1970s and early 1980 blew up. And the main reason it did is because what it requires for it to work is for a person to come in and you be able to say, okay, here's the problem and here's what we'll do to change it. And for the person to say, okay, I'll try that. But the people I was dealing with immediately said, you're saying I'm the problem. And so they were so sensitive to any invalidation or statement that they were the problem, that the treatment blew up. And they would either get angry at me, hide behind a chair, storm out, quit therapy, yell and scream, cry, or say they're going to kill themselves. So it didn't take me too long to figure out this was not going to work out. So I thought, okay, we're going to switch to a more acceptance-based treatment. So I'm going to validate and be very accepting. So I tried that. That blew up also, because then the patient said, you mean you're not going to help me? You're just going to listen to me? Most of the patients I treat have already been through a whole lot of therapy where you talk, get listened to, and understood. The problem is talking, being listened to, and being understood doesn't necessarily make anything change. So then they got really upset with me because I wasn't helping them change. So that's when I realized that I had to pull together a major emphasis on change with a technology of acceptance. So I had a technology of change, and I needed a technology of acceptance. The technology of acceptance primarily was validation. So it's behavior therapy with a huge amount of validation. So problem solving, validation are the core components of the treatment.
Good. So as you heard, what is DBT is a comprehensive treatment program that balances the need for the person to change while being completely accepted for who they are and in the present moment.
It's one of the Sashbear things. It's
Okay,
on DBT.
we're just gonna mute. Okay. Thank you. It's based on behavioral theory. Sorry, I'm French. I think you noticed. So I'm trying to switch in English now in my mouth. So it's based on behavioral theory, biosocial theory that I'll explain later, and dialectics. So the DBT treatment is based, it has 4 modalities. It has to mention that we do DBT. It has to include individual therapy, skills group training, phone coaching, and consultation team. Too often people think DBT is only skills training. So we have to correct that perception. DBT need to mention we're doing DBT. You have to have these 4 modalities in the treatment. It's been adapted for children of 6 to 12 years old, and to adolescents also. And it's been validated for these populations. Also, to say that we do DBT, the treatment needs to meet the 5 functions of the treatment. Here are the 5 functions of the DBT, of the treatment. Is first increasing motivation to change, and this is done by the individual therapist who's working hard on this to help keep the motivation of the patient, the client high, and restore it at every moment. Also, the other function is to enhance capabilities of the client. This is done by skills training. Usually, skills training is done in group. It can be done in individual session or family session for DBTC with children. But in adolescent, it's multi-family skills training group, and with adults, it's just the client himself, herself. Also, the other function is to generalize skills to real life, because as you can imagine, skills training is about acquisition and strengthening of using the skills, and the generalization, it means that you need to use the skills in every situation you need in life. So it may be very difficult to remember the skills during a crisis, and this is the role of the individual therapist to assist the client in generalizing the skills to real life. You have also to structure the environment to support change. This is usually done by the individual therapist also. And finally, you need to keep therapists motivated, and you need to increase competence in treating these complex situations. So for this, we need a consultation team. Marshall Linehan will say that if you have no team, you cannot say you're doing DBT. Even if you do anything else, you need to be in a team to be sure you stick to the model and you're supported and you're gonna be able to provide the treatment long term. So research evidence for DBT, as we mentioned already, DBT is gold standard treatment for borderline personality disorder or emotional dysregulation disorder. It helps reduce suicidal and self-harming behaviors. It also reduces emergency visits and hospitalization in people suffering from borderline personality disorder. It is used also, it helps for substance use disorder, depression, anger, impulsivity. It's useful also for ADHD, bipolar, refractory eating disorders, and many more. So it's used widely now. Sorry. And now we're gonna look a little bit more about what is borderline personality disorder. Borderline personality disorder is a pervasive disorder of emotion dysregulation system. This is the core problem, and from that problem, they have other problems like relational problems, but that it stands from emotional problem at the core, and also cognitive problem, identity disturbance problem, behavior problems. So we understand problematic behaviors related to BPD as either a function to regulate emotion or is a consequence of emotion dysregulation. So that's how we understand the problematic behaviors that happen. And about the biosocial theory, it explains how the BPD developed in the person. So, and it provides framework to the treatment. So how what is biosocial theory is, we think that people are born with emotional vulnerability, like it's biological. And emotional vulnerability has three components. It's high sensitivity, high intensity, high reactivity, and slow return to baseline. And the other component of biosocial theory is that people with this predisposition to emotional dysregulation experience usually pervasive amount of environmental invalidation. And just a parenthesis on that is that the environmental invalidation can be in with any person they meet and they have in their life. So it may be at school, or it may be at home, it may be with peers. So it's large. And a quick word about the skills. we have 4 type of skills that we teach people. So you have mindfulness. Mindfulness is the core of the treatment, the base of the treatment. Without mindfulness, you cannot do anything in treatment. So it's the basis for the treatment. And then you have emotional regulation that we teach, distress tolerance and acceptance of reality, and interpersonal effectiveness. So I think that is for my part. I give
I think
the
so.
mic
Unless you wanted to add something to what we have in there. Okay, so I will take over then. Family Connections was a program that was developed based on this entire concept of dialectical behavior therapy that Julie has described. So essentially, it was initially intended for family members of those who have borderline personality disorder. And that was a very particular population where not only did the people with BPD not really get a lot of good services, a lot of access to people who had good training to provide appropriate treatment, but the families themselves were very much seen as part of the problem for these individuals. And so the families, there were no services for families. Families really suffer when someone in the family is struggling with a mental health issue, and particularly with emotion dysregulation. There's a lot of burden, whether it's financial burden, emotional burden. There's grief around watching a family member suffer. There's stigma around the concept of a mental health disorder in your family, and even more so around BPD, because it was not very well understood for a long time. Family members also then experience their own mental health problems, such as depression. They're experiencing a lot of isolation. And so there was a real need for family members to be provided with support and also skills to help them in this situation. Essentially, the people who developed the program began to look at this as and understand that families can be part of the solution rather than part of the problem. So families need support and skills, and in providing that to them, they can then become part of the solution for their other family members. So Family Connections is a psychoed program that runs for 12 weeks. It's 2 hours each class over the 12 weeks on a weekday evening. And it's based on these dialectical behavior therapy skills and strategies. So it is by no means the entirety of DBT, nor is it even a full skills program. If you were to take a DBT skills group with a clinician like Julie, you would get the whole menu of skills that's available as part of DBT. Family Connections is a very carefully curated selection of some DBT skills that are particularly helpful for the family members and for those relationships within the family. And I'll talk more about those later. Family Connections is always offered free of charge. When it was initially developed, this was the decision that was made. And so everywhere around the world that Family Connections is offered, which is in over 25 countries now, it is always free of charge to the family members attending. It is evidence-based. It's copyrighted, it's manualized. That means that no matter where you take it across Canada or in another part of the world, you will be receiving exactly the same training, and that particular training that was research-based to show that it is effective. So it was developed in 2002 by Dr. Perry Hoffman and Dr. Alan Frizzetti, both of whom were DBT clinicians. Alan Frizzetti is still practicing. And it's typically implemented in group community settings, and it's delivered by trained peer family members. Now, it can be delivered by clinicians as well, and Julie is trained as a Family Connections facilitator, as well as being a psychiatrist and DBT clinician. However, most of the groups are delivered by family members like myself, who went to take the program, said, oh my gosh, this is life-changing. More people need to have access to this. And then we turn around, volunteer our time, learn how to deliver the program and share it with others. Sorry, I clicked my mouse in the wrong spot. Okay, so this is some of the impact that is known. Initially, there was research done by Dr. Hoffman and another colleague that predicted better clinical outcomes where there was higher emotional involvement of family members. And so just like I was saying before, where family members had been seen as part of the problem, there was now evidence to show that family members in fact are part of the solution, because this emotional involvement can make the situation better for people who have emotion dysregulation. However, it needs to be skillful emotional involvement. And so that's where the skills come in. It reduces depression, grief, and burden among family members. These are not just nice things to say. This has actually been measured in random controlled trials, and they have actually measured these same measures after people have finished the program and then 3 months later, and they find that the improvements continue to build. So the skills that people gain through family connections, they continue to use in their lives and families, and that continues to make an improvement. So it's not just while they're in the program, but on an ongoing basis. Part of what this accomplishes is that it enables family members to remain involved effectively in their loved one's recovery. So I don't know about anybody else out there, but I know for myself, when my younger child was struggling and we couldn't find services and we didn't know what the problems were, I reached a point where I was so depressed that I ended up being hospitalized. And so, that I think is not really, perhaps it's a bit extreme from some of the stories, but it's also not really surprising. I think a lot of parents begin to feel that sense of they're struggling so much that they can no longer be helpful to their loved one who has emotion dysregulation. So that's about taking that really negative situation and making it more positive. This idea of validation is about taking something that's already fine, maybe neutral or fine, and making it even better, which is to increase validation in the family environment and build trust in relationships. And that's a way of building those relationships, for example, between parents and kids. So the program itself is structured very much like a regular psychoeducational program. It focuses on education, on skills, and on support. So the education is specifically around emotion dysregulation. However, I want to highlight that this concept of emotion dysregulation came about, or it often refers to people with borderline personality disorder, but emotion dysregulation itself is transdiagnostic. So there may be emotion dysregulation occurring in people who have different disorders. It's also that emotion dysregulation and BPD are quite often underdiagnosed or misdiagnosed. And so we don't look at family connections as being targeted towards any specific issue, but where a family is struggling and thinks that this would be helpful for them, they are most welcome to participate and attend. So the education piece covers some of the pieces that Julie was speaking about, this idea of the biosocial theory, what people's vulnerabilities might be that might predispose them to becoming emotionally dysregulated in a pervasive and ongoing chronic manner, and the idea around invalidation from the environment, whether it's from the family, but not always. And even when it's from the family, it's not necessarily intentional. It's just something that happens. And so then the skills are the skills that are drawn from dialectical behavior therapy. And this is really the bulk of the program. Probably 11 weeks out of the 12 is spent specifically on skills. And then support. So it's not a support group in the sense that you might be used to a drop-in support group where somebody, you can go on an occasional basis and you talk about whatever you happen to want to talk about that particular day, or maybe there's a topic to discuss. In terms of the support, it's more about bringing together people who are learning together in a very positive and safe environment, and that builds connection for those people. So it's primary intention is not support, but support is one of the outcomes of participating in the program. So now the program has 6 modules. And if you look along the bottom of the slides here, you'll see the titles of the 6 modules. So the first one starts out as an introduction. And even though it is just an introduction. We actually start out right in the very first class with looking at some of this really core content around skills and around the education piece. So maybe I'll just start by reading through what these these quotes here. This is sort of a composite of different submissions that we've received from family members who have attended. When I found family connections, I was crushed, alone, mentally and physically exhausted, feeling guilt, shame, and blame. And I assume there are probably some family members out there who may resonate with some of those words. That first module gave me hope. I knew I was in the right place. I was in a nurturing environment that didn't show any judgment, and where I didn't hear, you should do this, or if you had only. So, that's probably familiar again. In this first module, a lot of the time is spent simply validating that families have really suffered, and that whatever emotions they're feeling and bringing in, frustrations, resentment, anger, hurt, all of those things are perfectly valid, perfectly reasonable for them to be experiencing, and you're in the right place. We endeavor to create an environment where everybody feels safe to share. And for some family members, this is the first time that they've ever been able to be in a place where they're allowed to really share and not be judged for their experiences or for their feelings around those experiences. We talk about the rights of relatives, which are basically the right that you can live your own life. You have a right to have a life that is worth living for yourself. You don't have to submerge all of your desires into the needs of your family member. And in fact, it can be better for everyone all around if you are able to find a better balance. And this is part of the dialectical part of dialectical behavior therapy, that when you are strong yourself and resilient, you are much better able to be involved and supportive of your loved one. And then we talk about some basic assumptions to be effective. And again, these are really foundational to the dialectical concept of opening our minds to different possibilities and trying to see what it might be like for somebody else, trying to see different possibilities than where we may feel we've gotten stuck. So I also have another note here that one of the things we do at the end of this very first class, the first module is for one evening only. And at the end of that first class, we haven't really learned much, but we've shared a lot. And we often ask people one or two words that they come to mind when they're leaving that first class. And some of them are things like encouraging. I don't feel alone anymore. Oh, I really want to learn more about this box of tools, this skill box that you're going to share with me. I'm excited, I'm hopeful, I feel validated. So even coming together for 1 hour to share experiences in this structured way is very helpful for family members. The second module moves into family education, and this is a bit more in-depth discussion of the biosocial theory and the vulnerabilities that Julie referred to. And we also talk about the transactional model, which is basically flowchart that lays out in a visual way the concept of how this invalidation reaches the person who has emotional vulnerabilities, and how there are many, many opportunities within any transaction to make changes to the way that we interact with each other. So as this person says, I learned that emotion dysregulation is a serious disorder and that my daughter was suffering a lot. Families often come in and they're feeling resentment and blame, and because they're struggling so much themselves. So to reopen their eyes to the possibility of feeling compassion that, maybe my teenager isn't just being a teenager and being obnoxious on purpose. Maybe they really are, some of this stuff is coming out of some pain and suffering that they are dealing with. Empathy started to kick in. The basic assumptions from the first class made me think differently. That was totally different than what I was used to, which was kind of always thinking the worst. And seeing others going through the same things as me was very encouraging. So then we move into relationship mindfulness, and relationship mindfulness we spent 2 weeks on. And this is the idea of what kind of things can we pay attention to in our relationship and in ourselves in order to move towards this goal of creating a more validating environment for our loved ones who are suffering. And some of the skills that are taught here are to become mindful of our own emotions and to become mindful of what we are bringing to the relationship. The idea of wise mind, which again is a dialectical concept. You'll hear that word a lot. This concept that we might think logically at some times and emotionally at other times. And some of us may have a tendency to one or the other a little bit more or in different situations. But this idea of wise mind is where we're bringing the best of our emotional processes and the best of our logical thought processes. And we're finding a synthesis of sort of inner wisdom, which allows us to make best choices in different situations. We learn the concept of primary and secondary emotions. So this concept of secondary emotions, this may be, I'm really, really afraid for my child's life. Because they're out late at night. I know they're using substances. I don't like the friends that they hang out with. My fear is really driving me, but what comes out is anger at my child. So that's an example of how your primary emotions can very quickly be submerged underneath a secondary emotion. And that creates a lot of problems in communication in families. And then the concept of opposite action, which is opposite action, how to explain it briefly. It's basically recognizing what your urge is to do in a particular situation that's emotional. And if that urge is not going to be to your best benefit, if it's not going to be effective in that situation, try to do something different. And the best way, occasionally, sometimes, is to try opposite action. Julie, I'm counting on you to stop me if I say anything misleading about any of these things. I'm keeping an eye on you, and as long as you're nodding, I know I'm doing okay. So opposite action can help you get away maybe from an emotion that's really big and kind of pushing you in the wrong direction, pushing you to ineffective action, and it can help you to modulate those emotions and behave in a way that's going to be more effective. So what some of our participants might have said at this point, it was heartbreaking for me to discover how invalidating our family environment had been for our daughter. And I want to reiterate, a family environment can be invalidating when the family has the best of intentions. People who have this level of emotion dysregulation, it's almost like they're walking around with a sign on their back that says, invalidate me, because their behaviors are so difficult for other people to understand. So the invalidation can often be coming out of the very best intentions from the other family members. So this family member, I learned skills to manage my own emotions better and to react differently, and therefore to build a more validating environment. I had done the best I could previously with the knowledge, skills, and support that I had at the time. Now I can put skills into practice to do things differently. And this is in fact one of the basic assumptions, which is that we are all doing our best in this moment. And we can all do things better and differently by continuing to try and learn new things. The fourth module is called Family Environment Skills. So those relationship mindfulness skills, you might have noticed, they're a lot about me. The family environment skills are where we start to take some of these skills and we look at more how we are using them in our interactions with other people. So this idea that our well-being is intertwined with all of the other family members. I mentioned before, people come in with anger, resentment, and blame. And blame and anger, those are not very helpful, positive, productive things to have in a family. So we talk about ways, many ways to reduce our judgment and to reduce our blame so that there's no blame, not even me taking blame upon myself. So we simply accept reality, which is one of the pieces that Julie mentioned as well. This concept of dialectical thinking, instead of seeing things as black or white, my fault, your fault, that kind of very polarized thinking, dialectical thinking helps us to break down that either or way of thinking. In many ways, it can be represented as simply as thinking about replacing the word but in your sentences with the word and. So instead of saying, I love you, but try saying, I love you, and it will, you notice it even changes your body language and your tone of voice when you change your language pattern. And the other person will hear all of that differently. And it allows a lot more of coming together rather than pushing apart. So for this family member, after module 4, again, this was 2 weeks, I started to be more emotionally involved with my daughter, trying to find a balance between taking care of her and taking care of myself. My daughter thought it sounded really fake at the beginning, but still she appreciated the change, as slow and small as it was. And maybe there's a but there that we could even take out. My daughter thought it sounded fake at the beginning, and she still appreciated the change. All right, we've spent now 6 weeks getting to this point in the program. We're halfway through, and halfway through, we can start to learn specifically about the concept of validation. Validation is essentially this idea that you can understand what the other person is going through, at least to a small extent, that you're going to make the effort to understand what they're experiencing, and you're going to express that understanding out loud to them in a way that they can hear you and really believe that you understand and have compassion and empathy for their experiences. So we talk a lot about what gets in the way of validating. There are many things that can get in the way of being able to validate effectively, or even thinking about validating in a moment. We've spent the previous 6 weeks working on a lot of things that can get in the way of validating, and now we directly apply those to situations where we want to try validating. We do a lot of practice in the groups around this concept because it doesn't come naturally, and it can be really, really challenging. And, our family members, our loved ones can look at us and go, oh my God, what are you saying, Mom? Like that just sounded so fake, just like that last quote. So we practice in the safe environment that we have created within our groups. Then we also talk about self-validation because, well, a number of reasons, but validation is super important for everybody to receive. There's evidence, there's a lot of research evidence that shows that what validation accomplishes is it brings down our emotional dysregulation. It lowers the temperature of our heightened emotions, and that can allow us to remain in that wise mind state. It keeps us away from reacting and allows us the time and space to sort of respond instead. And so we all deserve to be validated for the experiences and emotions that we're having. And we don't always get it from other people. So we also learn to validate ourselves. And it's important in a family group, particularly because, oh my gosh, families work really, really hard. And who else is going to tell us how hard we're working? Not our kids, right? So, that idea of self-validation means, we can recognize, again, what, this is hard. And, I'm doing a great job. I am really trying hard. Or, right now I'm feeling sad, and it's okay. It makes sense that I'm feeling sad right now. And, in an hour, I probably will be feeling a little bit better. Maybe I'll go do something nice for myself instead of beating up on myself, right? That's the difference. And it allows me to move forward by reducing my emotions and making me then more effective. So somebody here, talking about how it's a very difficult concept to grasp, especially if you have yourself come from a family where there was a lot of invalidation and a lot of dysfunction. So maybe first of all, you have to learn what it is. And then this person says, when I began to validate my daughter, she started to open up and to trust me with what she was sharing. With time, this put an end to emotional escalation and violence. Our relationship was healing. I was more understanding, and she could feel that. I was more balanced in my emotions. There's a lot of really key words in here. This idea that the daughter is beginning to open up. If they've built some more closeness and connection in the relationship, don't we all want our kids to open up more to us? So this is really the beginning of being able to have some of those difficult conversations. She began to trust me with what she was sharing. We talk about validation as a skill that will help you put trust in the trust jar, and you want to keep validating so that you can fill up that trust jar. You may need to make some withdrawals sometimes, and so therefore you need to make sure that that trust jar is as full as you can build it for the times when you do want to have those difficult conversations and you have to make a withdrawal from the trust jar. With time, this put an end to emotional escalation and violence. I have to say, this sounds very pie in the sky, and a complete end to emotional escalation and violence. I mean, maybe not, but it probably did feel that way. And it probably made a huge difference. And this emotional escalation piece, we know validation can bring emotions down, and violence is acting out on those really challenging emotions, right? And so if the emotions are being brought down, there's less reason or less opportunity for the violence to occur. The relationship was healing, again, about coming together. I was more understanding, and she could feel that. That's kind of the essence of validation. And I was more balanced in my own emotions. So again, this concept, this dialectical concept, and the idea of balance. So validation, we spend 3 weeks on. This is 6 hours of practice and discussion around validation and the skill of how to validate. And then the last couple classes are around, well, 3 classes are around this concept of problem management. And so by the time we've reached this point, this is where people want to start. I'll be completely honest. Every family member, and I've led a couple dozen of these groups, every family member comes in and from the very beginning is, okay, my problem is that my loved one does this all the time, and I need to know how to get them to change. They need to stop doing this. I need to fix them. There's got to be an answer. What's the magic bullet or the magic pill? And so, that's what we all want, because we're all so desperate. But there's a lot of work and a lot of skills to develop before we can be effective at beginning to approach specific problems from that real intention of wanting to solve them, of having an outcome of solving a particular problem. So we've worked on all these other skills all along the way. And then beginning in this problem management portion at the end, we now start to talk about different communication strategies that can be used together with everything else we've already learned to have some perhaps intentional conversations around change or around particular problems. Now, you'll notice the second point here has bolded collaborative problem management and problem solving strategies. So collaborative is the key word here. There are different ways of solving a problem, but we want to be able to do it collaboratively, because that's where you end up with a win-win for everybody, right? It's a solution for the way I view the problem, and it's also a solution for the way the other person views the problem. So again, it's about having come together rather than me having gotten my way, and you had to give something up or you had to change. So it's about working collaboratively with your loved one to be able to both make changes and shifts and understand each other better to come up with something that's going to be mutually beneficial for both of you. It sounds difficult, and it really, really, really is difficult, which is why it's at the end of the program. And actually, we don't really expect people at the end of the program to be able to use this right away, but we offer these skills to people with the proviso that we expect you to go off and keep practicing. You've spent 3 months with us in the program. Now go off, practice the skills for another 3 months. And maybe by then you will have so much trust in that relationship, and you will be so practiced at these new skills that you will be able to use them towards this concept of problem solving. So some of the skills that are in here, asking for something effectively. Again, it's not as simple as it sounds. You need to figure out very carefully and clearly what it is that you want to ask. You need to find a good time to do it. You need to think about how you can validate what's going on for the other person when you're asking them this thing that you want from them. And then you have to be able to manage your own emotions and the other person's emotions as that conversation proceeds. And so there's a lot to discuss there. And again, we do role plays and discussion around this, all the while admitting that this is really challenging and something that takes time. And then behavior analysis is another tool that we use simply to help us as family members to understand what might be going on in any particular interaction, particularly those ones that are, like the broken record that's skipping. Every morning I go to get my kid up for school. And every morning they ignore me. Every morning I knock on the door and they pull the blanket over their heads. Every morning it's the same thing and we end up yelling at each other. So the behavior analysis is a tool that we can use to help family members recognize more about what might be going on kind of behind the scenes in one of those interactions and maybe make some subtle changes to be able to have a different outcome. So by the end of this point, you're at the end of the program. And so this person said, I learned to speak the facts with no judgments and also to respect my own limits, which I never had done before. And notice it's limits, not boundaries. We're not drawing lines in the sand that somebody can never cross. We're talking about, this is my limit of what I'm willing to accept right now. And it can be very flexible. And we've learned how to withhold judgment, how to move away from judgment and to be factual and descriptive. So these are all communication strategies that we've been building up in baby steps from the beginning of the program. My daughter and I discovered that we could have conversations about things that were bothering each of us, and we could work collaboratively to find solutions that we were both okay with. And that really ultimately is the goal of all of this work that we do at Sashbear, and certainly the goal of the Family Connections program as well. So with all of that, we can take a couple questions. I just wanted to let you know how you can connect with us at Sashbear. The Family Connections program, as I mentioned, is free of charge to family members. And so you can go to the website and sign up there to get your name on the wait list. We begin new sessions every January, June, and September. And we do have a wait list, although we do our best to try and accommodate as many families as possible each session. As I mentioned before, our facilitators are all people who've taken the program. So we really care about getting it out there. So please, the best thing you can do is to come attend Family Connections, to tell other people about it, and to get involved if you feel so inclined once you have attended. We also offer an expert education series. These are all people like Julie who are experts in DBT, experts in research, in clinical application of these skills. We've got a number of them. I think we have 20 webinars recorded and available on our website now on topics like substance use in youth, on harm reduction, on self-harm and self-injury, on grief and loss, on dialectical behavior therapy skills from some of the experts like Ellen Frizzetti, who helped co-design this program. So that's a really incredible resource, and I encourage you to check it out. Also, the walk is something that is coming up. I mentioned the Sashbear walk. Hopefully, pandemic permitting, we will actually be having an in-person gathering. Before the pandemic in Toronto, we would have an in-person gathering at the Toronto Boardwalk of several hundred people coming together to simply show support and advocate, and really it's about reducing stigma. It's about really being present. You can see the idea of coming together and sort of making this orange splash by coming together is something that we want to do to help people with BPD understand that they're not alone, and to help families understand that they're not alone either. So that's coming up at the end of May. And so if anybody's interested in getting involved, coming to the event to find out more about what it is that we do, please feel welcome to. And then just again, how to contact us. Our website is sashbear.org, and my email address is fcprogram@sashbear.org. So you can email me with any questions or anything that you want to know about Family Connections or about any of the other things that Sashbear does.